Hello and welcome. We are getting started with our Ask Me Anything, where I answer the questions that and kind of speak to topics that parents have shared with us are the hardest thing that they have been wrangling in parenting life. I'm your host and the founder of Raising Our Resilience, also lead coach, lead parent empowerment coach. And I'm here to make sure that every new member has a chance to get some coaching with what it is that they are hoping to have support with these days. And so the questions I'll be sharing in our chat today are all from topics that were raised by new members. So welcome, welcome. And if you're here, that means that you are interested or maybe are very much in the need of more resilience in your life, whether it's for your children to have more emotional resilience as they return back to school, for your whole family system to have more resilience so you can weather things like changes and transitions, whatever brings you here, we're here for it. We're really so glad you're here. So welcome. If you're in the Facebook group and tuning in, it's always helpful for you to just drop a hello in the chat. Let us know what city you're tuning in from. Like for me, I'm in El Cerrito, California. How old the kids are in your care. So I've got a 23 and 28-year-old stepchildren, and also a bonus 8-year-old in the household right now. Yeah, let us know. And if you also have a question, queue up. You can see in the posts many questions that folks have asked, like Maria's is what we're going to kick off with this morning, but please feel free to go ahead and pop your question in the chat or comments as well, so we can support you. All right, so let's kick us off. How can we manage our son's anxiety to help him overcome school avoidance? Gosh, this one really stood out to us and my team as we were looking through the questions, and for good reason. You know, here we are in a school transition, trying to get a sense of how are we going to actually, get through the transition in a way that builds resilience, that helps the school year go, kind of get off to a strong start. And some of us are running into bigger challenges than others. Or maybe you've had in your history a season of challenge that you can, really relate to this question that this topic that is raised by Mary. Mary, thank you for bringing this to our attention, because we want to be able to get you what you need around, having what you need for the school year. So I'm curious, as we're getting started, if anybody else can relate to a tricky school year transition, please put me in the chat so we know Mary knows that other folks are also experiencing things that she's going through too. And Mary, what I've noticed when we're looking at school year transitions is that no 2 years are the same because our kids are a year older. That makes sense, right? Or maybe this is even the first time that your child is transitioning to school. How many of you have been there, right? And so I'm thinking for you, Mary, that the first thing I want to know and to support you with is, okay, this is not Mary, this is Maria, sorry. Maria Dejani, hi. Okay, here we go. So Maria, I think for your 10-year-old, yeah, you're here, great, okay, hi. You're like, this is my question. There's a couple things that are factors, of course. Is this a new school environment? Is it a new classroom, a new teacher, a new group of kids? Does your child have a peer or a friend to anchor in with? And if so, if any of those things are in play, just know first thing right off the bat that for any child, and this is for all of you listening, any child that's going through a school transition, the first 8 to 10 weeks are always going to be tricky. As a classroom teacher and later as an educational consultant, working with teachers, I always said, don't call in like extra, sort of support or sort of, rearrange things until you've given it a go for 8 to 10 weeks. Before you say things like this teacher's not a match, this school's not a match, or something else, give it 8 to 10 weeks. So we're there, Maria, right? We're in that window. just kind of finishing up that window. So it sounds like he has a new, is it your son? Has a new classroom, same school, same friends. Okay, all right. Okay, so then the other thing I would be asking is like, what are your child's top complaints? Like, what are they most anxious about when it comes to school avoidance? Okay, you're at 10 weeks, Maria. Nice. What kind of school avoidance are you noticing? Okay, so when you're saying high anxiety, I'm curious, like, how is that showing up? And the reason I'm asking is because you're here and we can actually kind of dialogue and I can coach you a bit. But more importantly, I want to get a sense of like what could be the core sort of fear driving that anxiety or worry. Because what we know about anxiety now, we didn't always know before. Like Brene Brown was just actually tackling this in her Atlas of Emotions, which is that anxiety and worry are cognitively based. It's not necessarily emotionally. It has an emotional root, but the activity of worry and a lot of the expression of anxiety is actually very much a mental activity, and it has to do with worried thinking and has to do with anticipation of the future based on maybe some impressions from the past. So what we can do, and this is what I want to consider with your 10-year-old, it looks like he's somatizing. He's starting to complain of stomach pains and things like that. Yeah, so it's starting to really, be somatized. Yeah, is that he's worried about needing to use the bathroom. It sounds like at school. So I'm imagining you've already tried strategizing with him about how he could take care of that at home first, right? At night and in the morning. But it's like, what is it about having to go to the bathroom at school that is worrying him the most? Like, is he worried that someone's going to know or going to go into the stall after him and say something? Is he worried that it's not going to feel good? Like he's going to have an experience where he's in pain and he's not able to tell anybody? Is he worried about like maybe not cleaning up well enough and staining his clothes or something like that? I've had some students who in the past who like only would go number 2 at home, like would not go at school, and it took about until 3rd or 4th grade for them to get over that hump. And we learned that for one of the kids, it's because the toilet made this really loud sound and it startled her every time. And so it's kind of hard to go number 2 when you're like worried about being like startled, right? So it kind of makes you clench. And that was part of it. And then another child, it was more about the smell, like not wanting their friends to either hear them go or smell it afterward. And so I'm curious, like what is it about being at school versus at home that your child is most concerned about in terms of going number 2? Like, I would want you to have a conversation with him around that. And I think the first thing to do though is empathize. Yeah. Okay. So you've offered all the things. All right. Okay. All right. So this is good to know. So we have some information from Maria. He wants to be at home. He's been offered private bathrooms, wipes, spray, etc. So it seems like you're doing everything you can to sort of deal with the external reality of like being in a shared space or leaving a smell behind and those kinds of things. And it's not really taking care of it. Okay. So then what might also be going on is that he says it's weird to poop at school. Oh my gosh, I love your kid already. He what also might be going on is there's something else that's also contributing to his anxiety. Oh, well, okay, there we go. The bathrooms are nasty. That'll do it. That'll be enough of a reason. This is a tricky one, but I think it's solvable. He's 10. Okay. So he's not quite at the age where he can leave campus independently on his own. Could you, for a short time, make it possible for you to pick him up for lunch, like maybe 3 or 4 times over the next 3 or 4 weeks, just so he can have the experience of like having a chance to leave and come back and try to use the restroom at home, just to kind of break up the pattern, because it seems like right now he doesn't want to go to school because he's experiencing this stomach ache of holding it. If you could go get some relief, that could be helpful. Just to know that like there's a way that he can get back to the toilet he feels comfortable with. The other thing is it possible to go into this, because you said according to him, which means like I'm not sure how much you've been into that bathroom with him, but maybe showing him like how he can actually like wipe the toilet seat and then sit on it, like sanitize the area could be something to try. I also think that there is something going on here just with general, some generalized anxiety around just maybe being at school, that it could be contributing, because if this is this something that he's been doing all his life, like since he was really little, he didn't like to poop at school, or is it more recent? Because it could be, and this does happen, where he has associated this experience with something else that he like is anxious about at school, that we could possibly like pull those apart and address the other piece separately, might help him as well. It says you've offered to pick him up and bring him home to poop. Okay, that's good. Now, offering and insisting are two different verbs, right? So I wonder about going forward with saying, look, buddy, like this has gotten to the point where we're just going to make a plan. We're going to make a plan where we're going to send you to school with the wipes, and we want you to go into the bathroom, wipe the seat, and see if you can handle sitting on it. If it doesn't happen, then you call me, I come pick you up. That's what's happening. And I just think there's something about the decisiveness of that might be comforting to him. Because right now, this is also around a little bit around control. Like, what does he have control over? What does he not have control over? And if it's just set, like this is the plan, I wonder if that will be actually supportive of him. Because I think sometimes when kids are having a strong emotion, the best thing to do is to give them a lot of leeway and give them a lot of like, it's up to you. What do you feel comfortable with? But then if that doesn't get you where you need to go, sometimes we do have to sort of intervene in this like stronger way and just come up with some structure. Now, that doesn't mean he can't weigh in on that. Like, so here's what I like to say for everybody who's listening who has ever been in a moment where you want to follow through on something, but you know that if you go in too strong, it might backfire. Every parent everywhere on the planet, right? At least once, maybe hundreds of times. You want to be clear about what's like when you need to just sort of lay it down. You can be very much strict about what is happening, but how it goes down is where the choices can be built in. And this is from toddlers to 2 to 22-year-olds. Okay, so it might sound something like this. Hey, buddy, we've gotten to this point where like, pooping during the day is something that's going to happen. We're going to make this happen. And what we're doing right now is having you try to go at school, and then call me if it doesn't work out. I pick you up, I bring you home. Now, how I enter like whether you're going to come out and meet me outside of school, that's up to you, or I can come in and come get you. Maybe there's a choice there, like depending on the school's protocol. Maybe there's a choice around like whether or not he's even telling his teacher the reason why he's leaving or not, or if you guys are going to come up with your own sort of white lie or like, family reason that you're picking him up. Like, oh, he might have an appointment today. Just to give you a heads up, I might need to pick him up, and he'll know, and he'll be able to let you know, and I'll come and get him. And he has a phone. That's why he has his phone, or that's why he can go to the office and call me. I'm just thinking about building in those pieces too that might be barriers to being able to follow through on the plan, as well as him having some control about how it goes. Yes. Okay. Yeah, got it. All right. And then I would be tracing back, Maria, to December. Like you were saying, it started kind of showing up in last December. What might have happened around that time that might be connected to this, if you can pinpoint it. Thank you for sharing too that he does have ADHD and anxiety as well. So I think also at 10, you can start to explain to him that a lot of this, even though there are like environmental factors, like the bathroom being gross, or maybe even internal physiological factors, like all of a sudden needing to go and not knowing how to, hold that comfortably. But then there's also the mental activity of worry that is associated to anxiety. And I think, having him work with one-on-one with a counselor, a school counselor, and or therapist might be something that you would consider if you haven't yet. But I think even, most talented counselors and therapists will talk to him about what it's like to get stuck in worried thinking loops, and wanting to help him disrupt that thinking very kind of like assertively himself, being like, I'm doing that thing again where I'm overthinking, or I'm doing that thing again where I'm thinking the same thought over and over again. I really need to put my attention somewhere else and give my mind a break because I'm kind of obsessing right now, or I'm kind of stuck. Helping him kind of have the self-awareness and then the tool of redirecting his attention, which, by the way, we're going to be going more deeply into in a December series that's coming up next month that we'll be sharing soon. So that would be a really good session for you to attend, Maria. Yeah, and I would be, working in concert with his therapist around this plan of how you're going to handle it when he does need to go, and acclimating him to the bathroom again, like the bathroom at school, whether it means like him going in for just 10 seconds, taking a few breaths and then leaving, just to kind of help him feel more comfortable with the bathroom situation. This is all recorded it's going to be up on YouTube, and it'll be here in the Facebook group for many, many, many months. So you can have a chance to re-listen to this. Yeah. Good. Maria, I am just feeling for you. Anybody else who's here or listening to the replay, please let Maria know how, like, what you see in this parent, because clearly you have a big heart and you're putting a lot of time and energy into helping your little one feel better at school. And who doesn't want that? Yeah, you're so welcome, Maria. Yeah, this is a good start, tip of the iceberg, I would say. But also powerful, right? Because if you can help him move away from that worried thinking to something that's a little more grounded, like, okay, I'm at school, I need to go to the bathroom, and that's okay. I can at least just go into the bathroom, wipe the seat and sit on it and see what happens. I'll close my eyes, like having some sort of little plan for how he's going to try to reacclimate himself to the bathroom when he doesn't need to go, and then also when he does need to go. And that maybe in order for you to pick him up and bring him home, like, he does need to at least try to go into the bathroom. Maybe he doesn't even need to try to wipe the seat and sit on it. He just needs to at least try to go in there. Could be the next thing to do. And yeah, I would be more assertive. Yes. Move away from worried thinking. Yeah. And it's really about disrupting the thoughts, challenging them, reality testing them. Like, sometimes we can play worst case scenario with ourselves. What's the worst case scenario? I'm in there and I get grossed out and I don't poop, but my mom still picks me up and I still get to go at home. That's not so bad, right? Like, just talking himself through it a bit, it's going to be a really powerful tool for him. And it's not an easy thing to do right away, but it can sometimes take really quickly. So I would see how that goes, Maria, and let us know, would you? Can you come back and let us know next week how that went? We'd really like to know. The other thing, if you'd like to talk this through more thoroughly, I do have some spots open for a one-time complimentary coaching session that I offer to folks here in the group, especially those who show up and really check out some of the tips. So if you'd like that, I can pop that into your into the chat, so you can take a look and see if those times work for you. And yeah, it's totally complimentary. We'll also see if it's a good fit to work together, but it truly is a strategy session. So we'll talk through what's going on and how we can what you can do next to support him. Okay. Yeah, I'd really like to have a chance to do that with you. Most definitely. Okay, got it. Yeah. So here, I'll drop that in right here. There you go. Yeah, I just talked to Judy, who's also in the group last week, and she also took me up on the strategy session. And it's amazing. Like, yeah, we can get to the bottom of things pretty quickly if we have a chance to actually chat, like we're starting to today. But yeah, much more in the strategy session. Okay, so now I've got a question from Liv, or a topic from Liv and Stephanie. So Liv, it looks like you are interested in help with what happens when kids test us, and Stephanie also with any kind of back talk. I hear you. Yes, we need help with that in our lives, don't we? And it's not because our kids are bad. Our kids are, trying to be difficult. Oftentimes, it's just a way that they are communicating something to us that we just wish they didn't need to communicate with us. So Liv, I know that you have an almost 8-year-old, and yeah, exploring no for the first time a lot with you. Okay. And you also have a strong-willed 15-month-old. That's tricky. Yeah. So you have your attention is definitely pulled in different directions, isn't it, right now? And then it looks like Stephanie, you've got, oh yeah, your 9-year-old is back talking. Yeah. And Stephanie's someone I used to go to school with back in high school in the Detroit area, Michigan. So my gosh. Yes. It's been a while, but it's so good to have you here in the group, Steph. All right. So when we're talking about back talk, it's often not actually what we think it is, right? Like you said, all behavior is communication, Maria. Nice. Yes, exactly. The thing about back talk is often like we've already been in a power struggle with the child. Like it's not something that comes out of nowhere. And so what I would want you to be doing is just kind of take a step back and say, like, how did we get here in the first place, right? Like what led to this moment of back talk? And you're both talking about kids who are, well over 6. So we're talking about something that maybe has been developing over several years. And I would be really examining, like, what pattern are we in that is leading to this? And what I tend to see with parents of 8 and 9-year-olds in that range, even 10, is that we're aiming a little bit too low in age in terms of parenting them. And what I mean by that is that most parents are 6 months to 2 years behind their child's developmental stage in their parenting approach. So we tend to lag, and the reason why is because kids keep growing. They don't even need to try; they just keep growing, but we need to put in the effort to keep up. So one thing that could be helpful is that first examine what are you giving them to push back on, and does it really need to be that way? Like, is there a more collaborative way to kind of approach whatever it is that they're pushing back on, so that they do have a little more influence and agency and sense of power and control that is more age appropriate? So that would be the first thing I would want to look at. The second thing is, are they used to getting feedback on their on the way that they speak to you? Or is that something that you've been able to address in the past, or has that always been a struggle? Because there's a whole zone there around boundaries, setting boundaries, getting clear about expectations, things like that, that if you haven't quite established yet, because either you haven't needed to, or it just hasn't come naturally to you, which happens for a lot of folks, now's the time. Before they're 13 and 14 and even older and can pick up the keys and walk out the door. So there might be some sort of backfilling to do around how we treat each other as a family, that kind of theme, and what happens when they start to slide into that zone. Now, the first thing you can do is give them the benefit of the doubt that it's more of an emotional response than anything, and that there's probably things you could have done to prevent it, and kind of stay in that space for a minute. So just noticing the themes and saying, okay, well, this seems to be all about whether or not she brushes her hair, or seems to be all about the chores, or this seems to be all about the dog or something. And actually have a little mature conversation outside of the moment and just name it. Hey, I've been noticing that every time I'm asking you to help out with the dog, you're seeming to have a hard time with it. Things that I've noticed is you'll groan and roll your eyes and tell me that I'm, say insulting things to me. And what I think you're really trying to let me know is that you're not really not really interested in doing that chore at that time, but that's not how it's coming across. Can we talk about that? Okay, so this is a very different conversation than you would have with a 5-year-old or a 6-year-old, which is aging it up a little bit. You're asking, can we have a conversation about this? And I wonder how they'd respond. They might rise to it. They might kind of look at you quizzically and go, what are you doing right now? This isn't what we do. Usually you tell me I'm doing it wrong, or usually you just let me do it, or whatever your pattern is. So I would be changing it up. And goal, something simple, like, instead of like, you shouldn't do that, or, like, wait, let me teach you a lesson. It's more, hey, what I would love to see is for, like, paint a picture. Kids are very visual. So paint a picture. What I would love to see is that when it's time for the dog to have care, and this being part of your chore, I would love to see is that you can get on board with that without moaning, growing, and rolling your eyes. You don't have to be excited and skipping towards the poop pile or whatever, but at least, like, we're kind of in a space where it's neutral and you're not being rude to me. What do you think about that? What would you like to see, right? And there's something about elevating the conversation up, like kind of aging it up, that kids can respond to. For example, like working with folks right now on their routines in our robust routines program, which we're in our 4th week of 6 right now, and it's going really well. Folks are seeing lots of changes. But one of the parents in that program, we were talking about her older child. We're like, okay, well, how does it go? And she's like, well, I was like, hey, it's time for this, and it's time for that. It's time to do this. It's time to do that. Like for the morning routine, time to brush your teeth, time to brush your hair, time to pack your lunch, time, right? Like telling them what to do. And I was like, well, you're going to cruise along with you being the one, pushing things along indefinitely unless you change your approach. And she kind of saw her life for the next few years being like, oh my gosh, this is going to be my role where I'm just giving all these reminders. And I was like, yeah, if your kid is old enough now to actually start remembering for themselves. Now, if they're neurodivergent, and need a chart and need your support in remembering that there is a chart, or maybe some alarms that go off every 10 minutes for time management. Like there's a lot of ways that we can support our kids, but we want to move them towards that independence. And I said, what if you start, instead of saying, what are you doing? Why aren't you brushing your teeth? Or it's time to brush your teeth now. Asking questions like, hey, hon, what kind of morning do you want to have here? Are we going to have the kind of morning where I'm like reminding you a bunch and you're kind of rolling your eyes and kind of slogging through it? Or do you think we could have a different kind of morning? Like maybe one where a bunch of stuff gets done. You don't have to hear a bunch of reminders. I don't have to give a bunch of reminders. And then we have time to like read at the end, or you have time to get back to your Legos, or you have time to whatever it is that they usually like to do with their extra time in the morning. Like what kind of morning do you want to have? And there's something about turning it back to the child that they're ready for at 8, 9, and 10, where they can start to go, oh, I actually can shape this. I don't have to, we both don't have to be in this old kind of pattern, this old dance where it's a power struggle. Like we can both contribute to its shifting. So I wonder about moving in that direction for Liv and for Stephanie with your kids, where it will feel more like you're talking to a peer or someone who's at least a little older, right? Where maybe they'll have a chance to rise to the occasion. Let me know if that makes sense to you, okay, Liv and Stephanie, and if there's anything anyone else is hearing that they kind of pulled out of that, because I think this is a big one. Like this isn't small. This is a big one, and I say that because I've seen it make such a difference. The other thing around the word no is that then they don't understand often where the request is coming from, and it's already too late to explain it because they've already decided, they've claimed a position and they're probably going to fight for it and hold it. So I would try just for maybe 3 times in a row, and this is particularly for Liv, saying, okay, you don't have to this time, but we're going to have a conversation about it. And then you just move on and you don't give it any more power, any more attention. And you do kind of redirect to, we're going to talk about this. And then that gives you a chance to strategize and kind of do some pre-gaming, which I love doing with clients, by the way. So if you'd like to pre-game with me as your complimentary strategy session, sign up for one. The link is in the comments. Because, oh yeah, did the link come through, Maria? Or sorry, shoot, I put it in there and it looks like it didn't post. So let me try that again. Hopefully this works this time. I think it timed out. Okay, there you go. Maria, let me know if that's there, okay? And this is also for Stephanie and Liv, like, let's pregame. Like, I wanna hear what exactly are they saying no to and pushing back on, and what can we get ahead of to sort of have that deeper conversation that gets them on board with your expectations or helps them to put their tone in check in the moment and really regroup. It kind of depends on what is it that they're pushing back on. And I've helped a lot of families with this. So let me help you too. Yeah. Hopefully this has helped you have a good start, a good head start with the time that we've had. Okay. So this is something that is very much related to the question that I'm going to bring on next, which is from Juliet O, Mumtaz M, Tiffany P, And let's see, there's one other person asking this question. The question is, how do I get my kids to listen more so I don't have to continually repeat myself for every task? All right. I love this question. Oh yeah, for Rachel LC. So the reason I love this question is because it's so related to what we were just talking about with pushback and everything. I mean, I literally just saying like an example of how about if I don't repeat myself over and over again? What if I do this differently, right? What if I come at this from a different angle? And I actually see like, what is it about this thing that is either not memorable enough, or they haven't practiced it enough, or the expectations aren't clear enough. There's something going on here that is requiring me to repeat myself. I'll share an insight from the classroom that might help you in particular, and I think you'll like. So what I found was that at the end of every day, us educators could sometimes be really tired. How many of you can relate? You know, there's only so many times you can ask somebody to put their shoes on or pick up after themselves before you just feel tired and frustrated even. How human of you. And one thing I noticed was that at the end of every day, we would have a moment to just kind of check in, and we could do one of two things. We could complain and be like, oh, these kids, why don't they listen? It's so hard. Geez, like why, you know, what did I do to my life? Becoming a teacher. And some of my coworkers also had to go home to their children. And it's like, and then I got to do it all over again with my own kids. And you know, just sort of complain in a way and vent, which is fine. We had that was one option, and we would do that. But the other option, which I would have to say I think is probably the more important one to put emphasis on, is saying, hang on, what could the kids maybe use some training on? And I borrow this from Jane Nelson's Positive Discipline. She says, take time out for training. It really stuck with me. And also from my Montessori background, where anything we expected them to do, and I really want you to hear this, anything that you expect a child to do, especially on their own, you need to show them how to do it if they're not doing it spontaneously. And take some time out for training to really show them how to do it, what your expectations are, to help them organize around when it's going to get done, why it needs to get done. So if you're reminding a lot, what that signals to me is that whatever you're reminding them about over and over and over again, they have not yet either learned how to do well enough, internalized its importance, or sequenced it in their day so that they remember to do it. And so that points to several things: routines, expectations, and motivation strategies. And when you bring those three things together, along with emotional mastery, conflict resolution, like sky's the limit on what kids can do on their own and what they will do without reminding, and how internally motivated they can be. It's pretty phenomenal. Like I've seen classrooms absolutely transform. And one of the practices I have teachers do, and this is what we would do at the end of the day, again, right? Here I am sitting with my teaching team. I would ask this question: what did you find yourself repeating? What reminders or directions did you find yourself repeating today, where you had to say it at least 3 times or more? And immediately we could all think of one. Tuck in your chair, put your rug away, you know, put your name on the help list, ask before you touch somebody's stuff, like just the gamut, right? Because I had 3 to 6-year-olds, and then I had 6 to 9-year-olds in my classroom, and then I raised 10 and 14-year-old all the way to adulthood. And if you keep asking, keep reminding the same thing over and over again, that points up like a laser pointer at what needs attention. This child needs to understand why this request exists, needs help sequencing it, needs to help internalizing its importance. And the best way to do that is just take a little time out for training. Hey, hon, let me show you how this works. Or, hey, let's have that more mature, right? A conversation if they're older. What kind of a afternoon do you want to have? Or what kind of a space do we want to have? What do we want to come home to, right? Asking those higher level questions. And then when you do that, what happens oftentimes is they've internalized it, and then the need for reminders goes away, or it's at least reduced in half. That's exactly what folks are doing in the Robust Routines program right now. That's what they're doing in my year-long immersion, is they're figuring out ways to help their kids internalize their routines and tasks and chores, and find their motivation strategies that really work for them, so that the relationship gets to shift from them sort of being this reminder robot. I used to call, I'm a reminder robot, going around just giving reminders, to more of a collaborative partnership of how do we want daily life to look like. Now, when your kid's really young, you're going to keep giving reminders. But what I would say is that every time you find yourself giving a reminder more than 2 or 3 times, take a break from reminding and show them instead. Do it alongside them. Think of it more like teaching them something, like, oh, they need to be taught how to do this. Oh, they need to be taught how to walk, put their hands in their pockets and walk away instead of hitting their sister. Like, it's not just tasks, it's also emotional intelligence and social intelligence sort of skills. We can absolutely take out time for training for those things. And really use what the good science of intrinsic motivation, where the motivation comes from within. That's what intrinsic means. It comes from within to help boost the kids' internal motivation for things. Now, that's something you don't know a lot about and you're curious about. You can also use your strategy session time for that. Like, you sign up for a complimentary session, we can do it. We can talk about the different motivation tools. We're also going to have a really good event in December that I mentioned earlier, where we're going to go over 6 coping tools and calm down tools in the moment. Because the other thing that happens oftentimes is that we forget to do these things because we're too stressed out and upset in the moment. And if we can get the calm parent first, if we can be a calm parent first, then all these other ideas can live. But if we're always stressed and reacting, and they're reacting to our reaction, and it's just like, oh my gosh, we're all having a hard time, it's really hard to even access these kinds of conversations. Yeah. Okay, so that event's coming up in December. We're going to post about it a bunch. It's called the Calm Parent Switch. I'm really excited about it. I think it's going to be one of our best ever. And then I will follow up with a masterclass that also talks about motivation hacks, of like how to inspire that intrinsic motivation, in December and January. So we've got really good learning programming scheduled up ahead, and it's all free. So we're excited to offer that to our community here. So stay tuned for that. Thumbs up, somebody just dropped, thank you, great. All right, so next question, I've got to keep this moving, but that was a big one. So I'm really glad that that was asked this week. All right, what can I do to control my own emotions and keep cool when responding to my child's behavior? Well, didn't we just touch on that? Yeah, so this is Robin and Juliet. These are your questions, and I very much encourage you to please come to the December event. It will rock your world when it comes to this, like, no doubt. So we want you. We want you there because we know we can help you, right? Like, that's the whole point. Because what the deal is, and this is, people won't tell you this, so I really want you to listen to this. What the deal is that we are co-regulating all the time and we don't even realize it. And but you do know that, like, if someone's in a funky mood around you, they can put you in a funky mood. If somebody's laughing and having a joyous time around you, it can put you in a good mood too, right? So it's a bit contagious. And what's going on there is we have these mirror neurons that fire, and then also, just if you believe in energy, right, we kind of catch the vibe of the energy of another person. Well, kids can be especially sensitive, like little tuning forks, to where our nervous systems really are. And what we can do about it is we can actually create a calmer baseline to our nervous system. And I remember Amanda Gates, she was the winner of the scholarship for the immersion last year when we did this event. And no, in June. Yeah, was it June? No, yeah, last year. And she said, all I want to do, Vanessa, is create a calmer baseline for my nervous system, because the way that I react and respond to my kids' behaviors is like, it's instantaneous, it's really hard, and then I'm stressed, and then he's stressed that I'm stressed, and so on. So she came to the training that we're doing in December, like the Calm Parent Switch, where we go over these 6 quick and easy tools to calm down in the moment. And what struck her was that not all of them were a fit. And I said, good. What we did during that is we went through 6 different strategies to help you figure out which one is your best go-to. But the thing that really stood out to her was that her go-to calm down strategy was different from her other family members, specifically her son. So for her, the breathing worked. For her son, it was all about getting that energy out. He absolutely had to expend the energy, like tense and release and all these activities, or it wasn't going to work. Like asking him to breathe, no. But for her, like the breathing was amazing, for example. So one thing I want to say to Robin and Juliet is that you can absolutely figure out a way to kind of have a calmer baseline for your nervous system response, but we need to find your go-to strategy. Like we actually need to figure it out. Like, let's do that. Let's go through the 6 strategies together and let's figure out which one is the one for you. Okay. So that's what I would recommend, Robin and Juliet, like find your go-to calm down strategy. And then my top tip, which I'll go into more depth in December, but practice that strategy outside of the times that you're actually upset. So don't wait for yourself to feel dysregulated and to lose your patience, lose your cool, lose your temper. Like I had a mom come to me and say, Vanessa, I just want to stop yelling. I don't want to yell or like burst out into crying anymore when I'm around my kid. I said, I got you. we're gonna get you to that resilient place, but first we need to figure out your calm down strategies. Which one's the best for you? So I would say go ahead and focus on finding the strategy that's your go-to strategy, and make sure you practice it when you're not upset, so that it's like a muscle memory. It's something that like it just comes to you in the moment. Like for me, it's a 4 square breath and a tense and release, like gets me so far when it comes to just down regulating and calming myself down. And then I also have some go-to ways that I do self-talk and reach out for support with my peers and my loved ones. So I have my kind of like my resilience plan in place. And when every family member has that, everybody benefits, as you can imagine. So that's something that appeals to you. Just write the word resilience in the chat or the comments, and I can come make sure and find you and give you a personal invitation to the event so that you have that coming to you without having to come back and find it. Just put the word resilience, even if you're on the replay, if you're watching on Facebook, if you're watching on Zoom or on YouTube, if you just put resilience into the chat, we'll get you that invitation and that free ticket for the December event where we'll go over those 6 strategies. We want you to have your own calm parent switch that you can flip, okay? All right, so there's that. And you heard a few examples, Robin and Juliet, to get you started. Yeah. I can also drop in a quick link to a calm down, like a guide that has 6 strategies, the 6 strategies we're going to go over, Robin and Juliet. I'll send that to you since this was your question. I want to give that to you, okay? Yeah, and I think Sharon says resilience. Hi, Sharon, so glad you're here. Yes, and I know you're also coming to our Emotional Mastery Weekend as a special guest to join the year-long immersion members in February, so that's really exciting too. Yes, all right. So next question, Sarah's is actually very similar, but I think there's something that stood out about this to my team where they wanted to really pull it out. So Sarah HN, you're asking, how can I be more patient with my child? So in addition to having your own strategies, your go-to strategies in the moment to keep your cool, I also want you to embrace that your child is doing their work. And what I mean by that, and this is also Coach Dr. Luce, who's on our team, very excited that she's on our teaching team and coaching team. She's a phenomenal educator and coach. Anyways, and parent. She would say, each age and stage of childhood has its work, like its goal, its objective. It's the thing that they're trying to do in that stage. So Sarah, I'm just going to glance and see how old your child is, and we can give you more specifics. Okay. Yes. Okay. So you have a 1 and a 5-year-old, and your 5-year-old, okay, is the one who's really, you said it's hard for you to be patient and hard not to lose your poop emoji on a daily basis. Grimace emoji. Okay, I'm feeling you right now. Yes, I've been there. Right, how do you not lose it on your little one? Well, your big little one, your 5-year-old. So what I would say is that at 5, they are making a transition from concrete to abstract. They are also trying to understand how power works in a more social sense, like who's friends with who and why, who's kind of like fun and who's not fun, who's a friend, who's not a friend, who's who's the leader, who's not the leader, who gets to go first and why, like 5 is interesting. It's really that pre-K into K time where they're starting to transition into that kind of lower elementary kindergarten kind of mentality where they're going to have an explosion academically of reading and writing and math and science. But they're also trying to figure out their little social, they like want to know what's going on with the pack a lot more than toddlers and early preschoolers. So understanding that it's their work, your 5-year-old's work to test how power and attention work in that social pod. So if you're seeing things like them being competitive with the attention from the 1-year-old, or being grabby with the 1-year-old to see what reaction they're going to get, that's them doing their work of growing and developing their understanding of how like society's basic rules work within the pod of the family system. So having some compassion for that is probably step number 1. And also that way it makes it feel a lot less personal, because there's nothing that helps us lose our patience more than feeling like somebody's doing something that is personal, if you know what I mean. If that's you, just put the word me in the chat, because that's me. I'll just put me. So if I think it's personal, ooh, like the rage that I learned from my mom just comes through. Like she can be really severe. It starts to bubble up and it starts to go there, and I'm like, ooh. And I usually notice, I'm like, am I taking this too personally? And usually the answer is yes. Yes. And it's because I've lost the bigger picture, which is that context. This behavior is happening within the context of this child doing their work, figuring out how power, control, attention, especially power and attention work in their social unit. Okay. So really embracing that they're doing their work. This is part of it. This is what 5-year-olds do. Helps to take the edge off of it feeling personal. The other thing is to start doing something about it, right? So whatever it is that you're being challenged by, know that there is room for growth and training and understanding and smoothing out and stronger, clearer boundaries with all of it. And the reason I say all of it is because I've absolutely seen everything and I've had to address everything with my thousands and thousands and thousands of interactions with children from in that age group. So all of it can be addressed. And I'm wondering how you're leaning in terms of your feedback to your child. Like, do you tend to come on really strong and strict, or do you tend to be like really empathetic and supportive of like their experience? Do you have a little bit too much of one and not enough of the other? Like, I would love to have a chance to support you with that, Sarah. So you too qualify for a complimentary session. So that might be something we could talk through and get to the bottom of, because I think there's probably more to it than what you've been able to share in your quick survey. Yeah, does that make sense? Okay, Sarah, I hope to support you soon. And y'all let me know if the times don't work for you, that you see on my calendar. Occasionally I can find another time or two that works better. So just let me know if that's the case. All right, so that link is in the chat. Go find it in the comments, yeah, for your complimentary session. Let's do it. Let's do it. Okay, I have another question from Jennifer. And let me know what stood out to you, y'all, like things that you hear that are helpful. I know we've got several folks listening here on Facebook and are going to listen to the replay later. And give us a little insight. What are you pulling out of this so far? We've covered a lot. This is Jennifer, who has a 7 and a 5-year-old, great ages. When they want to have all the answers and I don't have them, and they keep coming and pressing for details, like what exactly will happen today, and you just don't have it. That's when she's been most triggered. Okay, yeah, it's understandable, right? Because there's only so far you can go into that conversation before you're just sort of exasperated, like, gosh, guys, I just don't know. Can you accept not knowing? And the answer is yes and no. A 5 and a 7-year-old developmentally can accept some ambiguity, but they actually really do want to know as much as they can about what's going to happen so that they can prepare themselves. Now, Jennifer, there's a gift in this. I need to share it with you. May not feel like it at the time, but the gift is that your child is asking you to do something that a lot of my parents, I end up coaching them to do, and teachers that I coach and mentor, which is previewing. as much as possible. Previewing is one of those top level skills that when you get it into place, it can change daily life forever with your kids, because it also orients them towards being able to plan ahead and anticipate things and have more resilience for when they're in situations. Now, what it sounds like though, is that your kids want so much previewing that there might even be a little bit of anxiety running the show. And the reason I say that is because anxiety is not just worried thinking, it's worried thinking about the future and what might happen or not happen. So what your kids might need is a little bit more reassurance that and belief that when you get there, you'll still be able to figure it out. Like you'll have the resources available, whether that's time, attention, physical items that are available to address any unknowns. So I wonder if shifting from, gosh, guys, we don't know, we'll have to see when we get there, might be a response that you're giving now, and being like, you know what, you know why I'm not worried about it? And like almost let them in on a secret. We've gone to the park before and we've run out of things and we just go down to the corner and get something. You know, like if we need more water, there's a store around the corner, it'll be okay. Or there's a drinking fountain there. We can refill our water bottles if one of us forgets and share one. It's okay. You know, like, but what is this and who's going to be there? It's like, you know, what's great is that time and time again, like help them recall past experiences that went well, basically. Time and time again, like we'll go to the park and we'll inevitably see a friend. Like, I don't know who's going to be there. And worst case, we get to play together. It'll be okay. Like just that, see if you can identify any anxious thinking there and try and reassure them. And particularly describe with, because again, they are transitioning from concrete to abstract. Describe to them the physical resources that will be available, whether that's your time and attention, like, you know, you're going to be their playmate if there isn't a friend there, or there's a drinking fountain to fill up the water bottle. You noticed in my examples, right? And really exude this confidence in your ability and in the kids' ability together to figure it out if something unanticipated happens. And start collecting some stories of when that was true. Remember last time we went to the park, this happened, and then we figured it out by doing this. Yeah. Oh yeah, Sonia's here, one of my smart clients, alums. So good to have you here. You're welcome. She says, this is such great advice, Vanessa. Appreciate your expertise and mentorship. Well, appreciate you, Sonia. Teresa saying, teaching her 6 and 2.5-year-old children patience is the hardest thing right now. Yeah, exactly. So you really relate to this topic. So I think patience has a couple of edges, and one of them can be this anxious feeling around what is going to happen and are we going to be able to figure it out. Okay. So I really wanted to address that one today, and there are a few more edges. If Jennifer, you also qualify for a strategy session. Sonia's had one, Teresa's had one, folks who are here. Sharon has had one before. So yeah, if it's something that you're curious about, let's say just go ahead and grab a spot. Okay, last but not least, Chelsea Wilson Snow says, what types of meals and snacks can I give my kids that are healthy, but they'll actually eat? This one I'm giving over to the community. Teresa's here, Sonia's here, Sharon's here. I'm also going to throw some things here, but please pepper into the comments right now your ideas for Chelsea Wilson Snow. And I might even put in a separate post in the group that will go out to like 1,000 members, because we can come up with a really good list here. Yeah. But what I would say is just like anytime you can get them to eat fresh fruits and vegetables, do it. Like, I don't care which one it is. Honestly, I know carrots are sugary, bananas are sugary, apples are sugary. I kind of don't care. Like, just if you can get anything fresh in them, go for it. The other thing is that you can absolutely transform a kid's relationship to vegetables and fruit by coming up with dips that they like. And they don't have to be unhealthy dips, but you can start with things that are maybe not the healthiest, but it gets the fruit and vegetables in, like things like ranch and things like, or even really healthy things like hummus and avocado. And there's this one sauce, excuse my language, but it's called bitchin' sauce that we have in California. And it has now been starting to distribute everywhere that some kids just love. They'll like drink it if they could. So they'll dip anything in that just to get more sauce. So I'd start there, but please add more in the comments and chat, help out Chelsea here, and we'll throw up a post for you too, Chelsea. The other thing is helping them have some expectations around trying something at least once. or like taking a bite of something that you're serving can be really helpful to firm that up. And you can say, it's okay. And you teach them how, if they don't like it, how they can politely like put it in a napkin. That will possibly open some doors for you. Yeah, so dips and the try a bite kind of etiquette. See if you can get onto the other side of that, Chelsea, and I think you'll see a big difference. But other folks will have ideas for you too. Well, that concludes our Ask Me Anything for this week or this month. And we'll be back next week. And what I'd like to just really flag for everybody's attention is that we are going to have a really powerful training in December called the Calm Parent Switch. Sharon's been to it, Teresa's been to it, who's here, and many, many others. I think you'll love and adore. So put the word resilience in the chat if you want me to send you a link to register. I know I got Sharon's word resilience, but I will be sharing that with you. And then we'll be back next week where I'm going to tell you 10 ways to use a feelings chart, ways that you haven't thought of before that might surprise you. And you'll walk away with at least one way that you can use a feelings chart that's new and different and interesting to your child or children. So please come back for that, okay? And we'll see you on the 7th at noon for another Monday mindset moment. It's been a pleasure. Lots of love to each and every one of you. Please put replay into the chat if you are here for the replay, and resilience if you would like the link to our December event. I can give you a free pass to that, where we'll do the Calm Parent Switch. And of course, last but not least, those of you who qualify who have not yet had a strategy session with me, I highly recommend you grab a spot on my calendar. Okay. Lots of love to you all. Again, keep popping in some tips for Chelsea, and we'll see you all soon. Okay, bye for now.